When I think of what good cancer care looks like, it really looks like people getting access to the kinds of services they need delivered with great compassion and a degree of sensitivity to their particular needs. I think our greatest gap in actually getting to great cancer care or great care in general is frankly our own toxic positivity about what we're doing today. You can't solve problems until you actually name them. And I think we spend too much time celebrating mediocrity as opposed to really acknowledging some of the true challenges that we face. If you are someone of means, or if you are someone with social capital or connections, you get a different experience of care than if you are somebody who doesn't have access to those things. And we need everyone to have access to the backdoor in US healthcare. Everyone should get the same care as if they were a board member at a major comprehensive cancer center. And we have to try to arrive at a place where that's how these systems operate. Instead, we normalize the abnormal. We recognize that there is one system for people with access and connections and another system for people who don't have that. I think our work is to try to close the gap between the backdoor system and the front door system and make it really one door. I think we have some people who are individually, actually most people, are individually super committed to patients. But when you actually look at the aggregate and the system writ large, we create lots of discontinuities and frankly barriers for people, whether that's from the payers or the systems of care themselves. People don't necessarily get care that is truly centered around them. Take for example, patients with a new cancer diagnosis. That's probably the scariest moment in someone's life. And what do we do when we newly diagnose with someone with cancer? We make them wait. We make them wait for their scans. We make them wait for their appointments. And frankly, that's unacceptable. And we have to change the abnormal nature of our industry. We have to start naming the problem. We have I think a crisis in US healthcare wherein, we aren't actually speaking openly. Things don't get better unless we speak up. And the truth is that we spend too much time agreeing with each other. And so for everybody who's staying silent in the audience, you're part of the problem. We need to create a culture around this value-based care conference series, which is about actually naming the real problems and actually having the kinds of conversations that we need to have about what it's going to take to actually solve the problem of access. And it's not going to be about pointing fingers at pharmaceutical companies. And we have to actually look at every sector of US healthcare, whether it's the payers, I represent a payer organization, health systems, and look at what we are doing to contribute to the expensive nature of US healthcare delivery. It's too easy to name a boogeyman, and I think we have to go beyond kind of blaming everyone other than ourselves. And we actually have to look at ourselves and look at what is it that we can do to actually improve the state of cancer care in the United States.